Hello, my name is Maureen Jersby and I'd like to talk to you about a project at Northumbria University to embed sustainability into healthcare education. The project came about because in August 2021, the Faculty of Health and Life Sciences at Northumbria University were contacted by the Centre for Sustainable Healthcare and invited to take part in a pilot project to introduce their Sustainable Quality Improvement Framework into the nursing and allied healthcare curriculum. The Centre for Sustainable Healthcare identified that there's a gap in healthcare professionals' knowledge in how clinical practice contributes to carbon emissions and therefore impacts on the climate emergency. Overall, the National Health Service contributes 5% to the UK's total emissions and is the biggest public sector carbon emitter in the United Kingdom. Once we'd agreed to take part in the pilot project, we needed to consider where sustainable quality improvement fit with existing curriculum. As you know, with healthcare professional programmes, they're externally approved by the associated professional bodies. So therefore, anything that we introduce must complement the existing curricula and not make any changes to it. The Sustainable Quality Improvement Framework fits really well with service improvement. So where we had a service improvement module, it was really easy to include a sustainability seminar. Even if students don't choose to do sustainability for their final project, the talk component illustrates quality improvement in a real way to them. There's real examples of how quality improvement has been implemented in clinical practice. That quality improvement's got a sustainable component to it, but it illustrates quality improvement. And so it does really fit well with service improvement. Within the Master's Advanced Clinical Practice programme, the final year dissertation, the students have a choice of a service improvement project, empirical project, or a systematic review. So again, it fits really well with the service improvement teaching that goes alongside that module. However, if they don't choose to do service improvement for that dissertation, the majority of the students are also apprentices, and so the endpoint assessment change report is another way that they need to use service improvement and quality improvement tools. And so this is another way to illustrate quality improvement using real examples, and they can choose if they wish to make it a sustainable quality improvement. The actual seminar, prior to the seminar, the students are invited to watch some videos that are provided on their e-learning portal. One of those videos, the Shine video, is filmed in Newcastle. So as we're at Newcastle University, that allows them to see how what they're learning about is actually implemented in the hospitals where many of them do their clinical practice. And that's really helpful for them to see that this is really important in Newcastle, that sustainability is part of our healthcare practice. The seminar then allows them to look at some real examples and to start thinking about how they could use sustainability in their own practice. One student did do a sustainable project. This was in an undergraduate nursing programme, not in the AAPE programme, but it's an example of what somebody has taken from this project. The service improvement that was proposed by the student was repurposing of food waste. The student project highlighted that in 2018 to 2019, annual NHS food wastage cost £230 million, which is 39% of the total food budget. 14 million kilograms of food was thrown away, adding to landfill, carbon footprint, and the detrimental environmental factors of transportation, manufacturing, and increased spending. The proposal to address this waste was a bus A bus that was equipped with basic medical equipment and was set up in the centre of town so that the food waste was repurposed at lunchtime to allow staff to offer a nutritious hot meal alongside examinations, vaccinations, observations and wound checks. Now this is only an example of a proposal, and I don't know whether or not this student actually completed this, but I know she took it to the chief executive of the hospital where she was based doing her clinical practice, and it's certainly something to think about. The centre of my poster contains comments from students. These are from advanced clinical practice students about the importance learning about sustainability has had on their education, how important they think it is to become effective change agents, and to think about how large and small steps in their own practice can impact on carbon emissions and sustainability going forward. Since we started this project at Northumbria, the Sustainable Quality Improvement Session has been delivered to over 1,500 healthcare students across both undergraduate and postgraduate programmes. These students are now qualified and working as independent healthcare professionals across the United Kingdom, and they have graduated with an enhanced understanding of the link between their practice and climate change, and insight into how they can engage with the wider sustainable transformation of the National Health Service. We continue to review where further integration can occur across our programmes, but we also think about how we, as a faculty, consider our own sustainability. And we have recently set up a clinical skills sustainability working group where we are looking at our own practice. We're looking at what waste we produce in our clinical skills labs, and starting in September of 2024 we implemented some changes. So the first semester is about to come to a close, and we will start to review the data of how we've managed to reduce our own carbon footprint, but that will be another poster. After 2 years on completion of the pilot study, we were invited by the Centre for Sustainable Healthcare to become an established beacon site. We're one of only 2 nursing faculties to achieve this status in the United Kingdom, and we're the only site in the north of England. Established beacon site status demonstrates that we have met the Centre for Sustainable Healthcare criteria for integrating sustainability into the quality improvement teaching component of our core curriculum. And we do offer special thanks to everybody who's allowed us to achieve this and to support us on our sustainable journey. Thank you for listening.